Hi friends, my name is Preeti. So in previous video, we studied about parasympathomimetics. So today I'm going to discuss about parasympatholytics. Okay, this is the classification of parasympatholytics. Under this class, we have natural, semi-synthetic, and synthetic. Okay, under natural, we have atropine, hyoscyamine, and scopolamine. So here itself, you can see the structures. So here itself, we are completing medchem also. So atropine consists of tertiary amine. So in parasympathomimetics, which drugs contain tertiary amine? Physostigmine and galantamine. So except these two, remaining all they contain quaternary amines. Only these two contain tertiary amines. Okay, like this you compare whenever you come across the same similar topic, just revise the previous one also. Okay. So atropine consists of tertiary amine. Then this is the structure. This is the tropine ring and this is the tropic acid. The tropine ring. This is a tropic acid. And then L isomer of atropine is hyoscyamine. And the next drug is copalamin, which is also called as hyoscine. And it consists of a tertiary amine. And it consists of oxy group in its structure. It is totally similar to atropine, but it consists of an oxy group. And next, semi-synthetic, under this we get homatropine, epratropium bromide, and triotropium bromide. Okay. Homatropine is a tertiary amine, epratropium is a quaternary, and tiotropium is also quaternary. So once we can check this IUM, the drug ending with EM, tropium. For example, ammonium. Ammonium means it is a quaternary compound. Okay, ammonia means NH3, whereas ammonium means NH4 plus. Okay. So this EM compounds are four quaternary compounds. Like that you can remember. Whereas this INE, scopolamine INE and homatropine INE, all these are tertiary amines. Like that also you can remember. And the next one is synthetic. Under synthetic, there are two classifications. Chemical structure classification and therapeutic classification. So this chemical structure classification according to the medchem. Okay, and this therapeutic is according to the cology, based on the therapeutic actions. Okay, under chemical structure we have amino alcohol esters. It means they contain amine group, alcohol group, and ester group. So under this we get cyclopentolate, dicyclamine, clydenium, and glycopyrrolate. So here again you can see clydenium, EM. Again it is a quaternary compound. And dicyclamine, amine, tertiary. And cyclopentolate is also a tertiary compound. So just remember to which category they are present. If you are not able to remember the whole structure, then just remember what are the drugs which come under amino alcohol esters. Okay, at least you can recognize the structure if you remember that category. Okay, cyclopentolate, dicyclamine, clydenium, and glycopyrrolate. And more two drugs are there, propanthelene and methantheline. Here you can see here it is not ending with the EM, but it is a quaternary. Okay, sometimes some compounds are also there. I think only these two are there. Okay, this propanthelene and methantheline are again quaternary compounds. And next we come to amino alcohols. Previously amino alcohol ester. Now second group you remove the ester. We'll get amino alcohol. They are bipyridine and trihexyphenidine. This bipyridine consists of bipyridine. Name itself it is there. Pyridine, bipyridine. Okay, it is a tertiary amine. And trihexyphenidine it also consists of bipyridine, which is a quaternary amine. And procyclidine it consists of pyrrolidine ring. And next we come to amino ethers. Okay, alcohol is replaced with either orphandin and benzatropine. Orphandin and benzatropine. And aminoamides, tropic amide, name itself it is there. Tropic amide, aminoamide, amino ethers, orphanrin, benzatropine, amino alcohols, bipyridine, trihexyphenidyl, and procyclidine. Okay, just remember this. And next, therapeutic classification. Okay, based on the therapeutic action, mydriatics. The drugs which comes in mydriatics are cyclopentolate and tropicamide. So here tropicamide is a aminoamide and cyclopentolate is a amino alcohol ester. Okay, like that you revise the chemical structure also by leading a therapeutic one. And then anti-secretory, antispasmodics under these two classes, tertiary amine drugs and quaternary amine drugs. Tertiary amine drugs are dicyclamine, valethamate, and pyrazapine. And the quaternary amine, propanthyline, methanthylene. These are all amino alcohol esters. Okay, propanthyline, methanthylene, cladinium, glycopyrrolate, isopropyl, bipenzylate, and oxyphenol. All these are quaternary. And next, vesicoselective. Oxybutyrin, flavoxate, tolteridone, and darifenacid. See, no need of these structures. Only these structures are enough. Okay. And anti-Parkinsonism, anti-Parkinson drugs, bipyridine, procyclidine, trihexyphenidyl, benzatropine, ethopropazone, which consists of phenothiazide. Okay, just remember this therapeutic classification also along with the chemical structure classification. In theory, what we'll do is we'll have medicinal chemistry and pharmacology as two different parts. Okay, in chemistry we read this classification. In medicinal chemistry we read this chemical structure classification, whereas in cology we read this one. Okay, so only these chemical structure, the drugs of these classification are enough. The structures of the drugs under this classification, under chemical structure classification are enough. Okay. So here you can see the detailed structure of the drugs. Atropine, hyoscyamine, scopolamine, gomatropine, ipotropine, amino alcohol esters. These are the detailed structures of the drugs. Okay. Pause the video and check them out. And next we come to drugs acting on nicotinic receptors. Previously we have seen some of the drugs. Here I have written all the drugs. Okay. We have two receptors, autonomic ganglia and neuromuscular junction. The receptors on autonomic ganglia and the receptors on neuromuscular junction. Okay. Under autonomic ganglia, we have ganglionic stimulants and ganglionic blockers. Okay. Under ganglionic stimulants, selective stimulants and non-selective. Under selective, nicotine, labeling, epibatidine, and dimethyl piperazine. Okay. And then we come to ganglionic blockers, non-selective, atropine, carbachol, pilocarpine. Okay. There we have seen atropine and carbachol act on both muscarinic and nicotinic, whereas methacholine and bethanocol act only on muscarinic receptors. Okay. And ganglionic blockers, competitive blockers, trimethophan, sulfonium plus imidazole. It consists of these two, imidazole ring and sulfonium group. And mecanomelamine, which is a secondary amine, hexamethonium, quaternary, pentonium, quaternary, alpha vingarotoxin and alpha canotoxin. Okay, all these drugs comes under ganglionic blockers. And the neuromuscular blocking agents or skeletal muscle relaxants. Under this we have peripherally acting drugs acting on skeletal muscle, dantrolene sodium, and drugs acting at neuromuscular junction are non-depolarizing competitive agonist. Okay, under this again three categories: short, intermediate, and long. So this classification is very, very important. Okay, sometimes we'll have intermediate acting drug, short acting drug, long acting drug, like that they'll ask. Okay, just remember these. Short acting is mevacurium. Just remember any two you remember. If you remember short and long, leave the intermediate because the remaining drugs will come under intermediate. Like that, you read only two so that you can recognize the drug which is under the third classification. Under short, we have mercurium, and under intermediate, we have macuronium, atracurium, and rocuronium. Whereas under long, D-tubocurarin, doxacurium, and pancuronium. These drugs they have asked many times. D-tubocurarin, whether it is short acting, intermediate acting, or a long acting. Okay. This is classification of nicotinic receptors. And then we come to, there we have seen non-depolarizing drug. Okay, under neuromuscular junction, we have seen depolarizing and non-depolarizing. Till now, we have seen non-depolarizing drugs, and then we are seeing depolarizing drugs. They are succinylcholine, decamethonium, and succinylcholine. And third one is other. The other drugs are botulinum toxin. And dantrolene consists of imidazole and furan. Okay, dantrolene, it consists of these two heterocyclic drugs. And centrally acting skeletal muscle relaxants. Previously, we have seen peripherally acting skeletal muscle relaxants. Okay, these are peripherally acting skeletal muscle relaxants. And here we can see centrally acting skeletal muscle relaxants. Under this, we have mefensin group containing drugs. Mefensin, methocarbamol, carisoprodol, chlorzoxazone, chlormazole, and benzodiazepines, diazepam, GABA derivatives, baclofen, and centrally alpha-2 agonist azanide. Okay, just remember these. So these mechanism of action by benzodiazepine, all this we will read. We'll come across these drugs in central nervous system. Okay, then I will explain these mechanism of actions. Here just I have included because as we are reading the peripherally acting drugs, if we read centrally acting drugs also, we will get an idea. So I have added just the classification. So just remember these. And then next we come to the synthesis. Synthesis of acetylcholine. So the starting precursor is serine, amino acid serine. Okay, remember that. Serine decarboxylase will get ethanolamine, and ethanolamine, when it is acted upon by choline and methyl transferase, we get choline, and choline acted upon by choline acetyl transferase, we get acetylcholine. And here how it is metabolized. Acetylcholine, when it is acted upon by cholinesterase, we get choline and again acetic acid. In metabolism, remember the end products, and in synthesis, remember the starting product, starting precursor. Okay, serine is the starting precursor, like that synthesis and metabolism. So by this we have completed parasympatholytics also. So with this we have completed the autonomic nervous system, both sympathetic and parasympathetic. Next we'll start CNS. Okay. Thank you.